Well, we know there is a complex genetic component. There's a huge amount of research going on right now into the causes of lupus. And we know there's multiple areas in the immune system that are dysregulated, that all need to be dysregulated before you decompensate into a state of autoimmunity severe enough to cause lupus symptoms. You can be halfway there, have some of these markers in your blood, and still feel perfectly well and not have symptoms. So it has to be kind of a serial decompensation in the immune system. And it looks like multiple different genes are involved in probably overlapping ways. With all the genetic research in lupus going on right now, we'll probably end up with maybe 30 or 40 genes that will be lupus susceptibility genes, but one patient won't have all those 30 or 40 genes. They may have 6 or 8 genes from that possible repertoire, and that's enough to kick them into having lupus, while another lupus patient may have their own set of 8 genes, some of which may be in common with the first patient and some which will not. So it'll be sort of a combination of different genes that results in lupus syndromes, which are all overlapping and interrelated with each other.
What is known about the fact that the rates are so much higher in women than in men?
Well, we know that particularly the rates being so high in women is during the years where estrogens are high. So it really draws up the specter of what role are estrogens and progesterones playing and driving the autoimmunity. It must be playing some role. Because if you look at pediatric lupus before menarche, when female hormones are not high, there's not nearly as much of a female predominance. There's hardly any female predominance. And then once menarche occurs, then there's this 10-to-1, 20-to-1 female predominance all the way until menopause. And then late lupus occurring after menopause, once again, female predominance disappears again. And you get hardly any female predominance. So hormones are certainly playing some role. And we do know that estrogens do affect the immune system in direct ways, that they do enhance autoantibody response. So when you make antibodies against a germ, that's what happens when you take a vaccine. You make antibodies against your influenza or whatever. Having estrogens makes you have a stronger antibody response than non-estrogens. So there's factors that we know about with estrogens, but I think there's a lot more we don't know about to help explain why that's so. But certainly hormones play a role.
You mentioned also that African American populations have higher rates. Is there much research into why that could be?
Well, that's an area that's just starting to be explored now, and it's very important. It's not just African Americans, it's also Latino populations, Asian populations. So many minority populations have higher rates of lupus than Caucasian patients. And really the initial genetic studies were mostly looking at Northern Europeans with the genetics, just because when you're trying to do genetics, you're trying to eliminate population variation to try to identify the disease traits. But now we have a lot of catching up to do because it's probably most important to look at the genetic linkages in the patients who have the most severe disease. And we do have some of the most severe disease, particularly in our patients who are African American.
You mentioned earlier that there's this wide variance in how lupus can be expressed clinically. Is it possible that what we call lupus is actually a number of different diseases? And if so, is lupus still a useful characterization in the clinic?
Lupus is very heterogeneous, that it varies markedly from one patient to the other, but I think it's more like a spectrum rather than totally different diseases, that these patients will still be sharing genetic differences and that their immunologic differences from the general health population will correspondingly be similar. That it's just all a spectrum, once again, that they're drawing these susceptibilities from this pool of genetic susceptibility genes that I mentioned, and it's just going to be a variation of which combination they get is what flavor lupus they probably end up with. but that it's all sort of a spectrum of lupus. Uh, they do vary, and the fact that they do vary in their clinical manifestations and probably which particular susceptibility genes they have probably does have therapeutic implications, but I think lupus as an entity still is a valid characterization of what they have.